Chapter 12 discusses two different systems. One is the nervous system, and the other part is the psychiatry section. So there is two different parts, and it's a little bit longer lecture. So you guys can read the terms later. I hope you studied this in advance. And I will start with the anatomy and physiology of the nervous system. So in the nervous system, there are two different types of cells are there. One is called neurons, and this is an image of the neuron. You can also see the histology of the neuron. So this big cell is the neuron. And the other ones are the smaller supporting cells, and these are called glia or neuroglia, G-L-I-A. That has different functions. The neuroglia has different functions. So let's talk about the neuron itself. The neuron has three different parts. One is the dendrites. So these branches that you see, these are called dendrites. Dendrites receive information. Then this part is called the cell body, and that is the one that processes the information. So this image that you see here, this is the cell body. And the cell body has the nucleus, which you can see around here, the nucleolus. It has the Golgi apparatus and the plasmic reticulum, the ribosomes, all those, the mitochondria, so all of those structures that you see in a regular cell, you can also see it in the cell body of the nerve cell. Then it has a long extension. So this long extension is called the axon. Some of the axons are not wrapped by any other cell, and that's called unmyelinated, and some of them are wrapped by different cells, and these are called the myelinated cells. So this example here that shows in your textbook is this cell that's wrapping around part of the axon. This is called the Schwann cell. But there are other type of cells also. This Schwann cells is in the peripheral nervous system, but in the central nervous system, which is brain and spinal cord, that is called oligodendrocyte. So that's a different type of cell, but the function is the same. So when a nerve is myelinated, it means that the conduction is a lot faster compared with unmyelinated nerves. And you can see that one axon is covered by multiple of these cells. The Schwann cells are oligodendrocytes. Also, you can see that the axons can branches. It goes to different parts because it can supply different tissue. At the end, these are called the terminal ends. That is enlarges in this area, and the chemicals. These chemicals are called neurotransmitters, and they are located or stored here, and once there is a stimulation, they are released from these axon terminals or terminal ends, whichever you call it, different names for it, and then it will affect the postsynaptic tissue that is here. So it can be a muscle, or it can be a gland, or something else, or adipose tissue, or something like that. This is a different part of the brain. So the brain is divided in a very simple form into 6 different parts. One is the cerebrum. So this is the largest part of the brain. There are 2 hemispheres, and I will come back and talk about each part separately. Then the second part is called diencephalon. So it's located in the middle, and the encephalon is made of the thalamus. So this area is the thalamus, this area. Hypothalamus. There is also another area that's not in your textbook. This is called epithalamus. There is also subthalamus, which is not shown here. So there is different areas for the encephalon. Then is the brain stem, and the brain stem is made of the midbrain, pons. So this big area is the pons, and medulla oblongata. And finally, the last one is the cerebellum. So this is the cerebellum. So there is this 6 different parts there. The pituitary gland is not part of the nervous system. It is part of the endocrine system, but it is connected with the hypothalamus. So hypothalamus has a lot of effect on pituitary gland. The medulla oblongata, by the way, it continues with the spinal cord. So this is the spinal cord. So this is the different functions. This slide talks about the different functions of the cerebrum. These folds that you see, that is called gyrus, G-Y-R-U-S, gyrus. And these grooves that you see, that's called sulcus, S-U-L-C-U-S, sulcus and gyrus. So the deeper these sulci are, sulci is the plural form of sulcus, and it means the person is smarter because that increased surface area. So there's a few sulci are there. So if they are very deep, they are called fissures. Okay, but then also in some other books they call it sulcus, so it doesn't make a very big difference. Okay, this is here the central sulcus separates. This is the frontal lobe, and this is the parietal lobe. So there's two lobes that are separated from each other by the central sulcus or central fissure. There's another one. This is lateral fissure or lateral sulcus, which is this one, and that separates the temporal lobe. This is the temporal lobe from the frontal lobe and the parietal lobe. There is also another one here, and that is located most posteriorly. That is called the occipital lobe. So these lobes have different functions that are there. So let's come back to the frontal lobe. The frontal lobe is important for the movement. So all the conscious movements that you do is located there, and also the patterns of movements are located in the cortex of the brain. So when you walk, when you, for example, bike, when you type something, when you learn something, a musical instrument or athletic activities, those movements are stored around this area. And then when you consciously decide to do something, then the information is accessed from here and then sent down to the spinal cord or brainstem. The frontal lobe is important for your personality and also important for other functions that for the planning and for the judgment, for the thinking. Part of your emotion is also there. It also affects your behavior. So the social norms, things that you have to avoid, those are all located in the frontal lobe. The parietal lobe is more related to the sensations, so all the sensory informations are coming there, and recognition of sensory stimuli take place in the parietal lobe. Occipital lobe is also sensory, but the special sense of vision is located there. From the eyes, it all the way ends up in the occipital lobe, and that information is stored there, and also things that you can see is processed there. In the temporal lobe, the hearing is there. Also sense of smell. Sense of smell is located more medially than this, so that area is there. Also the sense of taste, if you open this area, there's another area, and that sense of taste is located there. There is another area here, that is the language area. This is for comprehension of written and spoken language. That's called Wernicke area, and that's located here. And cerebellum is for the balance and for the posture and coordination of motor activities. Okay, so diencephalon is one is the thalamus. So most sensory information except the olfactory, which is sense of smell, goes to thalamus, and if the information is important, then it's sent to the cortex of the brain. Thalamus also participate in the motor activity. Hypothalamus has a lot of different functions. One of the functions is endocrine system, which we talked about it in the previous lecture. The other one is the control of the body temperature, and that has affecting the autonomic nervous system. So if, for example, the temperature is high, then the body metabolism decrease, and also there is behavioral change that happens. For example, you take off extra clothes and you turn on the AC and things like that. And if the temperature, the body temperature is cold, then just the opposite will happen. That the metabolism increase, and also there is a muscle activity increase, so shivering happens, and behavioral change like putting extra clothes and turning on the heater or closing the windows, things like that will happen. So hypothalamus has a major effect on the body temperature control. It is also important for the appetite, so thirst and hunger center is there, so that controls the amount of feeding. Sleep is part of hypothalamus function, but there's also other areas of the brain, like epithalamus is also important for sleep. Sexual desire is there's a nucleus there in the hypothalamus, and that is partially responsible for sexual desire. So that's part of another system that's called limbic, Limbic, limbic system. The emotions also affected by the hypothalamus, but also the limbic system and the prefrontal cortex is part of the emotions. And the autonomic nervous system, which I will talk about in a few minutes, that is affecting the visceral function, and it's controlled by hypothalamus. Cerebellum, it is receiving sensory information from the joints and from the muscles and the tendons, and that process information, that sends the information to thalamus. So one function is processing sensory information for the movement, and the other function is that fine-tuning of motor activity. So it's important for the balance and for posture. The brainstem has 3 different parts, and they have some different functions. The midbrain is important for the visual reflex. For example, when you turn your head when you see something, and auditory reflex, when you hear something, you turn your head. And also it's important for consciousness. So sensory information that comes there is processed partially there and keep you awake. Pons is an area between midbrain and medulla oblongata. The respiratory center is there, and also there is a connection that is between the cerebellum and the cerebrum. Medulla oblongata is the area between spinal cord and the rest of the brainstem, and in general the rest of the brain. So these are the vital centers are located, like heart center, vascular center, respiratory center is there. There is vomiting and coughing, swallowing, many other functions are there. The spinal cord is located in the vertebral column. So this is the vertebral column, and this is the spinal cord. It is starting from the end of the medulla oblongata until L1 and L2, so around this area. And it receives sensory information from the skin and joints, and also it carrying motor information to the muscles. So these are the spinal nerves that are there. The spinal cord is divided into 5 different parts. One is the cervical area, so it's about 8 nerves are there, and then there's a thoracic area that is 12 nerves, lumbar area that is 5 nerves, sacral area that's also 5 nerves, and coccygeal that is 1. But there is not as simple as that, because these nerves, I don't want to go into details of that. They connect with each other, and then they create networks of different nerves, and then those networks are actually doing the functions to the skin, joints, and the muscles. So in a simple term, spinal cord is processing sensory and motor function. It also has reflexes, And reflexes are some of the negative feedback mechanisms to protecting different parts of the body. Then central nervous system is protected by a type of connective tissue, and these connective tissues are called meninges. There's three different meninges are there. The one is called dura mater. There is actually two layers of the dura mater. So one here and there's another one here. It's not shown in this image properly. So one is attached to this bone and another one is here toward the brain. And there is a space here between the bone and the meninges, and that's called the epidural space. So there should be one gray area around here, but unfortunately it's not shown here in this image. So it should be like that. And then there is a space below the dura, and that is called the subdural space, which is shown here. And then is you have the arachnoid. So arachnoid is thinner than the dura, so the dura is much thicker here. And there is these fibers that connects the arachnoid all the way to the pia mater, which is the deepest meninges, and that pia mater connects directly to the cortex of brain. And here in the subarachnoid space, you have fluid, and the brain is floating in that fluid. That fluid is called CSF. Also in this area, there are veins there, and the CSF drains through this structure to the veins. The veins are called sinuses. These are the peripheral nervous system. Part of the peripheral nervous system is cranial nerves. So there's 12 of them on each side. The first one is called olfactory, and that is processing sense of smell. The second one is called optic nerve, and that is for vision. And the third one is called oculomotor. Oculomotor has two different functions. One is controlling the movement of the eye, and also is important for the changing in the size of the pupil and the thickness of the lens. And I will talk about that when we get to chapter 13 for vision. Trochlea is also controlling the muscles of the eye, and if I go here, abducens also controls the muscles of the eye. So three nerves are motor nerves that are controlling the function of the eyes. One is the cranial nerve 3, the other one is 4, and the third one is cranial nerve 6. Coming back to trigeminal, trigeminal is the thickest the cranial nerve. It controls sensory information in the face, but also has chewing muscles. Muscles of mastication are controlled by the trigeminal nerves, and it has three different branches in three different parts of the face. Facial nerve is cranial nerve 7, and it has a mixed sensory and motor nerve. It controls the muscles of facial expression. It's also supplying most of the glands in the face. So the glands in the eyes, in the nasal cavity, and the oral cavity, so they are mostly supplied by the facial nerve. Also, it's important for the special sense, which is the sense of taste. The anterior two-thirds of the tongue is supplied by the facial nerve. Vestibulocochlear is cranial nerve 8, and that is a special sense, and there's two types of senses here. One is for balance and the other one is for hearing. So vestibular is for the balance and cochlear is for the hearing. Cranial nerve 9 is glossopharyngeal, and that's again a mixed sensory and motor nerve. So for the sensory, it is part of the pharynx, and also the posterior part of the tongue. Also a special sense, which is the sense of taste, which is the anterior, which is the posterior, 1/3 of the tongue, posterior 1/3 of the tongue. And also it has a motor supply for the muscles of swallowing. A vagus nerve is the cranial nerve 10, and this is the longest cranial nerve. It is mixed sensory and motor. It supplies sensation for the thoracic and abdominal organs, that also supplies motor function for thoracic and abdominal organs. It also has function in the pharynx and larynx area. Cranial nerve 11, this is accessory nerve, and that controls two muscles, which is important for movement of the head and neck, and also partially shoulders. Hypoglossal nerve, this is a motor only nerve. This is cranial nerve 12, and that is important for control of the tongue muscles. So part of the peripheral nervous system is the spinal nerve. This is coming from the spinal cord or entering a spinal cord, so both ways. If it is sensory, is entering a spinal cord. If it is motor, is leaving a spinal cord. So this is important for the supply of the skin and joints, and also the skeletal muscle. So all the conscious sensory motor activity that is passing through the spinal cord, these are nerves are responsible for it. So you don't need to know the details of this, but just the basic idea here. There's a lot of details about each one. So this is the different nerves that are coming from the cervical area of the spinal cord, and that's making the cervical plexus. This cervical nerve is incorrect. It should be cervical plexus. Plexus means a network of nerves. And then is the brachial one. The brachial one is supplying the upper extremity mainly, and that is coming partially from the cervical area and also from the thoracic area. Then these are the intercostal nerves, which is coming from the thoracic area of the spinal cord. And by the way, for the brachial plexus, you have different nerves here. One is the radial nerves, which is going and supplying the back of the upper arm and upper forearm, and also the back of the hand. So everything on the upper limb, the posterior part of the upper limb, sensory and motor, mostly supplied by the radial nerve. There's also median nerve that is supplying this part of the hand. There's ulnar nerve, which is more medial to that. There's multiple other nerves that are not shown here, so I will not discuss those ones. But you can ask me later if you have any question. Lumbosacral plexus, this is actually two different plexuses. One is lumbar one, which is more superior, and the sacral one, which is more inferior. So the lumbar one is supplying the anterior part of the thigh and the medial part of the thigh, and the sacral one this is the sciatic nerve. This is actually located posteriorly, and then it divides in the peroneal nerve and then the tibial and fibular nerves. So this is supplying the leg area and the feet area and the back of the thigh. So the sacral plexus, I meant. Autonomic nervous system, this is controlling visceral functions, so the organs. There's two different branches. One is sympathetic, the other one is parasympathetic. Sympathetic increase cardiac activities, increasing heart rate and heart contractility, increase the blood pressure. So it's contracting the blood vessels. It also dilates the airways, but decrease gastrointestinal function and also reduction of the urinary and reproductive system. It also increases breakdown of fat from adipose tissue and also glycogen from the muscles, so increase ATP and also muscle activity. The parasympathetic is the opposite of sympathetic system, so this is happening at rest, while sympathetic system is for a fight and flight function. So the parasympathetic is decreasing heart rate, is decreasing blood pressure indirectly, not directly, indirectly, because it does not have a direct activity on the blood vessels. So If the heart rate and the heart contractility decrease, that also affects the blood pressure. It also increase gastrointestinal system, so it's important for digestion and absorption, increase urinary and reproductive function, and decrease formation of the ATP from breakdown of fat and glycogen. So the muscle activity also decrease. Signs and symptoms: paresthesia is an abnormal sensation. Anesthesia is no sensation. Hyperesthesia is too much sensation. So there is different type of sensation. Seizure is the way that is written in your textbook is a little bit incorrect. So seizure are signals that are coming from a specific part of the brain, and these signals that are coming back down to the muscle. Seizure means just one specific episode of abnormal signals that are sent from the brain to the muscles. So if you have multiple of them, then you will get epilepsy, but seizure just means activation of a specific part of the brain that controls skeletal muscle. And convulsion is when the muscles contract because of those seizure signals that are coming from the brain. So the actual contraction of the muscles, that is convulsion. Palsy is inability to control movements. The person is able to move but not properly control the muscles. Ataxia is related to cerebellum. So this is lack of coordination. Again, the person is able to move it but cannot properly execute the function. And plagia is muscle paralysis. So plagia and paralysis is the same. There are different types of plagia. One is paraplegia, which means the lower part of the body is not functioning. Most likely it is damage to the lower part of the spinal cord. It can be monoplegia, so one limb is damaged, or hemiplegia, which is half of the body is damaged, or quadriplegia, which means all four limbs are not working, so they are paralyzed. A coma is a state that the person is unconscious. The consciousness itself has 7 different stages, and coma is the deepest stage. That means the person is not arousable, the person is not be able to waken up. Syncope is not a coma, so sometimes some people confuse that. Coma is a neurological condition. Syncope or fainting is a cardiovascular function. So if the blood pressure suddenly decreases or the heart function is not working properly, then not enough blood goes to the brain, and then because of lack of oxygen and glucose, then the person goes to and become unconscious or faints, but that is nothing to do with the actual neurological function. This is from cardiovascular. Delirium and dementia. So this can also be confused. Delirium is an acute state, so there is a decrease in the level of consciousness and presents as confusion and disorientation. And agitation is more an emotional and behavioral change that happens during delirium. Compare that with dementia, which is a chronic condition and a decreased mental function, and usually problem with the memory, and then could affect the behavior and emotion as well. TIA, the transient ischemic attack, is a decreased blood flow to the brain that lasts only 24 hours, and after 24 hours everything is okay. But again, you have to go and investigate why that happened, because this may increase risk of stroke. So stroke is loss of blood supply to the brain, which means the blood tissue dies or infarcts, and that can caused by many different conditions. The most common condition is thrombus formation or plaque formation in the arteries, Another one is an embolus, that is mobile, coming from a heart or somewhere else in the body, and stuck in the brain. Also, increased blood pressure cause bleeding, and that will cause that. Or sometimes, that's not that common, compression from outside structures, for example, a tumor or abscess or something, or a cyst, and an artery blocks the artery, and that may cause a stroke. So a stroke is usually irreversible, but TIA is reversible. That's the difference, the big difference. Cerebral aneurysm is a cause of stroke. It means that the blood vessels in the brain are weak, and if the blood pressure increase, then they may rupture, and that can cause stroke. Sometimes people are born with cerebral aneurysm, and you never know until the person has a rupture of the aneurysm, and then they suddenly have a stroke, and that can happen at any age. It's not just old people. And migraine is one type of the primary headache. There's 3 different types of primary headaches. One is called tension headache, which is the most common, and that happens due to stress. And another one is called cluster headache, which is usually unilateral on one side of the face, and they have vision and yeah, they have usually vision problem, and also they may have problem with their nose, so they have increased secretion from their nose, but that happens more commonly in men. But the migraine is a common type of primary headache, and that is more commonly seen in women. It can affect one or both sides of the face and head. Okay, so that is not always unilateral, it can be bilateral also. They may be very sensitive to sound and light, so they prefer to stay in a quiet place and an area that is dark. They may see things that is not normally you don't see it, and that's called aura. They may have nausea. Sudden change in the atmosphere may cause that also, or may precipitate that also. Wine and cheese may cause that changing in menstruation. So if a woman has her menstrual cycle, that increase migraine attack. During pregnancy, it increases. So there are different precipitating factors. Concussion and contusion, these are 2 different types of conditions that caused by trauma. So concussion is a mild trauma in the brain. The person does not lose consciousness, but with a cerebral contusion that is much more serious, and that lasts more than 24 hours, compared with concussion is less than 24 hours. So the person may have dizziness, and then they lose consciousness, and that's a serious problem. The intracranial pressure increase, and that will cause vomiting, and the size of the pupil will be unequal. So that's, both of them are because of increased intracranial pressure. So anybody that has a concussion or a trauma in their skull, and if they become dizzy or they lose consciousness, they have to stay in the hospital at least for 24 hours because of the cerebral contusion. Hydrocephalus is too much production or lack of drainage of the cerebrospinal fluid, the CSF that I was talking about it before. So the brain and spinal cord is floating in that fluid, and if too much is produced or not enough drained, then hydrocephalus happens. Hydrocephalus can happen at a very young age or a very old age, and the effects and the treatments are a little bit different for each age. Cerebral palsy is a problem with the control of the muscles, and here it can happen before the labor. So something happened during the late stage of the pregnancy, or an event that happened during labor or after labor, and this happens usually when the baby and infant is very weak, and parents, they go and they may sue the um, gynecologist, the obstetrician, that they did something during delivery, but most of the time this is not a mistake from the doctor. It's usually caused something before, during, or right after birth. But the problem is very difficult to prove it. That's why it's easy lawsuit against doctors. Okay, some movements disorder. So one is the Parkinson's disease. Here there is a dopamine level decrease in the midbrain, and the person has tremor. Tremor is rapid involuntary movements of the usually the hands. Weakness, there is a weakness of the muscles, and also the muscles are rigid. It means they're very stiff. The reason for that is too many signals are coming down from the upper part of the brain and it's not filtered. So this is why the muscles are very stiff, and they have a specific gait. It's called shuffling gait, which is a small steps. And they don't have sensory loss, by the way. Epilepsy is something that I asked and talked about it before. That is that multiple seizures. So it is a chronic condition. If the person has multiple seizures, that can cause convulsions, then that's epilepsy. So one episode of seizure may not be epilepsy, because seizure can happen from a fever. High fever can do that, or electrolyte problems can do that. But epilepsy is more specifically to the brain disorders, and that's a chronic condition. Alzheimer's disease is a type of dementia. It's a very common dementia. As the patient getting older, then the risk of Alzheimer's disease increases, especially in women. The person with Alzheimer's disease, they may have disorientation. Disorientation may be in time, and in person, and also in location. So they may have all three type of disorientation. They also have a problem with behavioral problems, so they don't connect with anybody, with people surrounding that patient. And also they have amnesia and memory loss. And the memory loss is usually more recent memory loss, but the old memory loss is called tertiary memory loss. This happens later on. So because the tertiary memories are from childhood or events that happen many times, so it's stored in a different part of the brain, but the new memory is formed in a different part of the brain. So that area that's called hippocampus, that is more damaged initially, and then other parts of the brains are damaged later on. So that's why the patient may remember the family members or close friends until later part of the Alzheimer's disease. Reye's syndrome or Reye's syndrome, both of them are correct. So if a person has a viral infection and they get aspirin, they may get inflammation of the brain, and then that's called Reye's syndrome. And usually it happens in children younger than age 8, so that's why it's contraindicated to give aspirin for any viral infection, especially respiratory infection. ALS, or Lou Gehrig's disease, this is a motor-only disease, and this affecting the spinal cord. So the pathway that are coming from the brain is damaged, and also anterior horn of the spinal cord, which is carrying signals to the muscles, they are both damaged. And this is a progressive disease. Unfortunately, there's no treatment for it. Polio is a viral infection, and that's affecting the anterior horn of the spinal cord, and this is where the motor neurons are located. And that depends on the severity of the condition. Sometimes the Person may have a mild disease, that they may have weaknesses in the muscle, and it may be okay later on, but majority of the cases the person become paralyzed, and if they are not vaccinated, so that paralysis is permanent. So that's why vaccination is very important, to have polio vaccination. The spina bifida is a congenital disease, and that is affecting part of the vertebra. It's a posterior part of a vertebra that's called lamina, and if that area is defected, then meninges may pass through it, or even the spinal cord may pass through it, and that condition is called myalomeningocele. So either the spinal cord, the meninges, or both of them can pass through this defect. Bell's palsy is usually affecting cranial nerve 7, and they have one-sided facial paralysis, so the eye cannot close, and they have drooling of them from the mouth. That usually self-limited. In about 3 weeks, things will go back to normal. Guillain-Barré syndrome is an autoimmune condition, and it starts from lower extremity, affecting the Schwann cells and going upward, so the muscles are becoming weak. Multiple sclerosis is also an autoimmune condition. It affects the central nervous system and also the peripheral nervous system. So it may affect the sensory system, and also it will affect the motor system and vision, and it may go from one area to another area. So it may be progressive or may be stable. It depends on the type of multiple sclerosis. Myasthenia gravis is also an autoimmune condition, and here the antibodies attacks the receptors in the membrane of the skeletal muscles, so the neurotransmitters does not have much effect on the receptors of the muscle, so that's why the muscles cannot be activated and they are weak. This condition is coming due to due to skull damage, which may cause brain damage also. So hematoma is collection of the blood anywhere in the body, and here in this case is in the skull. So epidural is the outside of the dura. So if this is a dura, this is outside. So this is actually the way that they drew it is not actually correct. So this, if it's epidural, it should be around here, and subdural, this is the subdural one. But epidural is more serious than subdural because in epidural arteries are damaged, and subdural veins are damaged. So epidural is much more serious. So it will be a mass around this area. And there's also another one that's called subarachnoid, which will, the accumulation of the blood will be around this area. So depends on the type of it, the blood accumulates in different part of the meninges. The diagnostic test, one is called cerebrospinal fluid analysis. So they can look at the white blood cell, red blood cell, and any kind of bacteria. They also look at the proteins, the pH, glucose level. So this for diagnosis of different conditions. Lumbar puncture is that's the procedure that they put the needle and they remove CSF. EEG is that they put electrodes on the skull, and they're analyzing and recording brain activity, electrical brain activities, and this is important for people with seizure and epilepsy, also for people with stroke, people that are in coma, people who have cancer, that can be used. Nerve conduction is done for somebody that has a muscle weakness, so electrodes are placed in different parts of that nerve pathway, and then electrical signals are sent, and if the muscle can contract, that way they will know if the nerve is damaged or not. So this is for the muscle weakness and nerve damage. Cerebral angiography, this is an image of cerebral angiography. They put a catheter through an artery, they put a contrast, and they want to see the blood vessels, if all the blood vessels are there or not. Sometimes you may see some abnormalities like this one. So this is an aneurysm that is there. They can put specific material inside, and they can fill this area so it will never rupture. And in a patient with a stroke, for example, in one part of the artery does not show, it means that that area is blocked. So it's really for the patient with a stroke, this is the gold standard diagnostic method. It doesn't mean that they will do it all the time, because there are other methods available, but this is the best one that you can see where is the damage. And a PET scan they give a radionuclide glucose, and glucose is important for the function of the brain. So they will look at the activity of different parts of the brain. So the more red area is there, there's more activity there. Sometimes if there is one area is not active, then they know there is a damage in that area. Some of the medication, one is the hypnotic. Hypnotic, it makes the person sleepy. Compared with the hypnotic with the sedative, that makes the person relaxed. But if the sedative is taken with higher dosage, that may also become hypnotic. And there is also compare that with anesthetics. Anesthetics reduces sensation. It may or may not cause loss of consciousness, but with anesthetics, especially with general anesthetic, you have to take an hypnotic as well. Also, usually they give sedatives as well, because you want the patient to be relaxed before any type of surgery. And for pain medication, you have analgesics, which is non-steroidal analgesics, like Advil, aspirin, things like that. Or you can have the narcotic ones like opioids. So initially you start with a non-steroidal one. If the pain is really serious, then they can give narcotic analgesics, but narcotic analgesics increase risk of addiction, so you cannot give it for a longer period of time. A nerve blockage is if there is somebody has severe pain, you can do that, or if you want to do any kind of surgery, you can locally block a nerve, and for a period of time you can do the procedure, and then after that the nerve blockage goes away. So it depends on the conditions. Either you can treat the pain condition. If the pain is chronic, you can block that area, or if for anesthesia, you can do it for a shorter period of time. Another part of this lecture is the mental health. So there is two different fields that discusses the mental health. One is psychology, the other one is psychiatry. Psychology is important for human behavior and thought processes, and it is evaluating the human interaction with the environment and also with each other. So a person who wants to be a psychologist, they have to do an undergrad study, and then 6 or 5 years of psychology. So it's a PhD program. Psychiatry, on the other hand, is for diagnosis and treatment of mental diseases, and the person has to do undergrad and then 4 years of medical school, and then about 5 years of psychiatry. So the person that is specializing in psychiatry is called psychiatrist. There are some diseases that overlap, and both psychologists and psychiatrists can treat it. Psychology, if it is depression and anxiety, personality disorder, a clinical psychologist can treat it, and also a psychiatrist can treat it. So, but many other diseases should be treated by a psychiatrist. So you can read these parts yourself. Let's start with anxiety disorder. With anxiety, there is a high level of stress, and the person is worrying about the specific situation. So there is different type of anxiety disorder. One of them is panic disorder. Here is the stress and anxiety and worry is so much, but it's a very acute attack, and that attack, the person is not able to concentrate on anything specific. The person may have shortness of breath. They may have even chest pain, but that is an acute situation, so it will go away. General anxiety disorder, that's more a chronic condition, weeks and months of high level of anxiety and stress that may cause this condition. Phobia is that you have fear from something that is not logical. You should not worry about it or have a fear, but if you have a fear from that, that's called phobia. There's around 100 different types of phobias are there. Common ones is phobia from closed spaces, phobia from heights, phobia from failures. There's social phobias are there from spiders, from so many other things that are there. Obsessive compulsive disorder, there's two different conditions together. Okay, so obsession is that you want to think about, you are thinking of something repeatedly. That is obsession. For example, you're thinking whether you turn off the light when you left the home, or whether you closed the windows in your car or something like that, or unplug the iron. So this is obsession. You're thinking repeatedly, or thinking about your GPA. Compulsion is that you're going and doing something. For example, repeatedly washing your hands, or going and checking the door if the door is closed or not. So that is compulsion. So, but they usually are together, and that is because of anxiety. You're thinking to reduce your anxiety, but that's actually your brain is continuously thinking of the same situation again and again. Neurocognitive disorders, here is the mental function decrease. Dementia is a good example. So the person has a decreased level of consciousness, which presents as confusion and disorientation. And as I mentioned before, disorientation can be with time. So they don't know exactly what time of the day or the week or the month is. They cannot recognize close family and friends, and also they don't know where they are. So that is dementia. They can also be affected by decrease in their memory. Alzheimer's disease is decreasing mental function, so they have memory loss, and they may have emotional and behavioral changes, and also they may be confused and disoriented. And I gave the example of Ronald Reagan, who died of Alzheimer's disease. Neurodevelopmental disorder, this is happening in younger patients compared with neurocognitive disorder, which is more in older patients. So one is intellectual developmental disorder, and that is they have a sub-average intellectual ability. In other words, they have a lower IQ, but IQ again is a test that is debatable, and it's not a very accurate test for the level of intelligence. Attention deficit hyperactivity is that there is two different conditions. One is that the person is not able to concentrate. The second part is the person is very active, and this is usually diagnosed between age 4, 5, maybe 6 by the child's school teachers or kindergarten teachers. They can be diagnosed. Unfortunately, this has been abused a lot because medication that is for ADHD is increasing their stimulus and increasing mental activity, and there are students that are taking it during high school, during college years, during professional years, and that can be easily abused, and they're doing their career by using some chemicals, which is unfortunate. Autism or autistic disorder, this is patients that again happens in a younger age, and they may have problem with the communication, they may have peculiar behavior, and they do not socially interact with others. So they are okay with close family members, but with others they are not very comfortable. They can be very smart, but the major problem is the communication and their behavior. Dissociative disorder, they may have gone under a very stressful emotional event, and that's why they get this disorder. Usually this is a chronic condition that happened. The risk factors, a chronic condition that happened. One is dissociative amnesia, that after a period of severe stress, the person lose memories, and that's a defense mechanism. They don't want to memorize or remember those bad events that happened to them. And the other one is dissociative identity disorder, and again this patient have been abused physically or sexually or mentally, and they may have two different personality. And I gave this example of I, Me, and Irene. Jim Carrey was in that movie. So when you finish your school during summer, maybe you can watch this movie. Not very funny, but okay for this as an example for this condition. Feeding and eating disorders. So one is anorexia nervosa. These patients, usually they're young teen that are young female that are during teenage years, and they have problem with their body image, and they don't want to eat, and even if they're losing weight and they are still thinking they are obese. The problem with that is that once they lose a lot of fat, the gonadotropin releasing hormone is not secreted from hypothalamus, and that will affect pituitary gland, and then it will affect the release of estrogen and progesterone, so they may become infertile. Also, it will cause kidney damage and heart damage, and sometimes those damages are irreversible. So it is a mental issue, unfortunately, and the image that you see on the right, it is an image of a person with severe anorexia nervosa. Anorexia in general, that's a different condition. Okay, sometimes people lose their appetite, they don't eat. That can be can be from different diseases, or can be from the stress, or it can be from other conditions. There are so many different reasons for it, and that can happen at any age. But this is specifically anorexia nervosa happens in a young female, so during early teenage years. And bulimia is also more common in women than men, much more common in women. Again, this eating disorder, they eat a lot, so this is binge eating, and then they try to lose weight, so they are vomiting and they have diarrhea, and they're taking medication to have diarrhea, laxatives or diuretics to urinate more, so they feel guilty about what they did, and then they want to go back and they lose weight. This happens at a little bit older age than anorexia nervosa. Disruptive impulsive control and conductive disorders. So there's different conditions that they want to harm themselves or somebody else. One is kleptomania, like stealing. Example is Megan Fox. Pyromania, they want to set fire, so they can do brush fires. Sometimes you have seen it in the news. People, they go and they burn somebody else's houses. They love to fire different things. An explosive disorder is that they get very upset, and they yell at people, and they fight, and they damage properties. Example is Mel Gibson. So bipolar and depressive disorder, one of them is the major depressive disorder, and here is the idea of interest and hope comes. So hope is really important, a powerful feeling. Just imagine if you do not have any hope that you don't graduate, or there is no hope for any you finding a job, or you stay healthy, or things like that. So hope is really important, that make you do a lot of things throughout the life. You came to college to study and then complete your undergrad, so that's a hope, and you want to go to professional or graduate school, that's again a hope. So all of those things are important, and there's a lot of things that you want to do because you want to keep that hope. But when the hope is not there, then there's lack of interest. So you don't have any interest to do anything. So then what happens, that will affect your appetite. So you may eat a lot, or you don't eat anything. It may affect your sleep pattern, so you sleep a lot, you don't have any sleep. You also have a problem with the social interaction, so you do not want to go to work, you do not want to interact with anybody. So that is a lot of unfortunate things that can happen. And they are at higher risk of suicide. So anybody that has depression, as a healthcare worker, you have to ask if they ever thought of suicide. Mania is opposite of the major depression. This is that the person is talking a lot, they are very happy, at least they pretend to be happy, and they do go and gamble, they do a lot of shopping, they engage a lot of different sexual activities, they talk a lot, they may be angry, and they fight with others. So there is different presentation. And bipolar is just a change, an alteration between the depression and mania. And example is Demi Lovato that I give this. Sometimes the person is depressed, and other times they act like a maniac. Personality disorder, there are 6 different types of them. There is only 3 of them are explained in your textbook. One is the paranoid personality. Here the person thinks that others are trying to harm them, or they are against them, and they want to do any physical or financial damage to them. Example is the dictator of South Korea, which I think in this image he's so proud of his hair style. Narcissistic personality disorder, here the person is so much obsessed with himself or herself. I gave an example of Paris Hilton, but there are politicians also that are very narcissistic. Sometimes they are obsessed with their own interest. Antisocial personality disorder, these are the ones that are doing very abnormal social activities. They are breaking the law, they are steal things, they kill people, they do a lot of illegal activities. If it is under age 18, they are usually called conduct disorder. Over age 18, antisocial. So majority of people in the jails, they may have personality disorders. Schizophrenia and psychotic disorder. So this is a change from reality. One is the delusional disorder. The delusion is that they believe that somebody else is, they believe against facts. So they think the facts are not real, and the things that they think is real. So some politicians are like that, unfortunately. An example here, I put Putin, that he thinks the West is always after Russia, but again, politics, you have to think about all sides of that. So delusional disorder in general, it means that you are believing in something that's not real. Illusion is something different. Illusion is it's not about believing. Illusion is that you see something that is you are misinterpreting something that is there. So it's just a misinterpretation of visual stimuli. That is illusion. And hallucination is something that's not there at all, and you either hear it, or sometimes you feel it, or most likely you will see it. So that's hallucination, and Van Gogh had a hallucination. Something that is not there at all. Hallucination is compared with illusion. Illusion, something is there, but you misinterpret. But hallucination, nothing is there. So, but you see something that is not there. Paraphilic disorder, one is the pedophilia. Pedophilia, the interest in children, that they want to abuse children. That happens in every culture, unfortunately, and every religion. And I gave an example of one of the church cardinals. I think he was sexually abusing children, but it happens in any type of society, which is unfortunate. Sexual masochism is, there's actually two different disorders. So another one is called sadism, sadism, sadism. Sadism is more common in men, and they want to inflict pain during sexual activity. For example, they want to choke their sexual partner, or suffocate sexual partner. And sexual masochism is much more common in women, and they enjoy being hurt, or have pain during sexual activity. A voyeuristic disorder is you see that that is much more common in men, and they enjoy seeing others during sexual activity. Probably paparazzis. With sleep-wake disorder, so one of them is insomnia. This is where you cannot go to sleep, and there are so many different causes. Some of them you can control it. For example, if you don't drink caffeinated, drinks, or coffee and tea and things like that, or if you are not using electronics late at night, or if you want to reduce your stress and anxiety, which is not easy. So those are, some of them are controllable, but some other stuff may not be able to be controlled easily, and that may cause insomnia. So there's different reasons for insomnia. Some are more difficult to treat than others. Narcolepsy is a specific type of sleeping disorder that the person suddenly becoming sleepy, and then they go to sleep during the day. So it can happen at night. It can happen anytime during the day or at night. And they are in danger because they should not drive, they should not swim, because that can be risk for their own health or somebody else's health. Also, students are at high risk of narcolepsy. During my lectures, they go to sleep, right? Somatic symptoms. So here is that actually there is no disease, that the person feels or under stress of having a disease. So there's two types. One is called somatic symptom disorder, and here they are obsessed with their health. For example, they don't want to eat any specific foods. They think that they may get a disease, or they're trying to have a lot of a specific food to prevent a disease, or they have a very mild symptom that may not have anything important, but they think this is very serious. For example, they sweat, and they think, okay, they may have a virus or something, a serious virus, or they may have a small headache, and they may think they may have a cancer or something. So they are these conditions are more common in elderly patients, and also patients that are working in healthcare. So students and also healthcare workers are more commonly see this condition. Conversion disorder is a little bit different. They have a lot of stress and anxiety that is so severe that it actually presents with a physical sign and symptom. So that may be a cardiovascular problem. For example, they may have chest pain and palpitation, they may have neurological problems, they may have visual problems. So this is a little bit difficult to diagnose. So when these patients come to ER, you don't know if this is actually a physical symptom or a psychological. So if there is a psychological, if there is a history there, then it's easy to diagnose. But otherwise, the first time that the person comes, it will be difficult for the doctor, and the doctor may order different tests, and most of them will come negative. So then, based on that, you may think it might be a conversion disorder. Substance abuse and addictive disorder. So substance abuse, it can be for illegal chemicals, for example, alcohol, or illegal drugs like cocaine, morphine, heroin, things like that. So those are also, it can be prescription medication that sometimes some doctors give too much pain medication for some patients, and those are not good doctors. That the way that they are practicing, this is not, they are not doing good. So for example, Michael Jackson died because of that. And I put the picture of Charlie Sheen because he was using different drugs. Unfortunately, he also is HIV positive. And gambling is that you lack the excitement. So this is a different type of disorder, addiction, that people may lose their friends and their family and their financial status because of gambling. Gender dysphoria means that you're not happy with the gender that you're assigned to at birth, so you want to change that. Sometimes if it's a male, they want to become a female, or a female wants to become a male. There is a lot of psychological counseling involved, at least a couple of years. And if the patient still feels that way, then you can have hormonal therapy, and then even you can do surgical treatment, so you can change not the whole reproductive system, but the external genitalia to male or female. They may not be able to carry, become, that will affect their reproductive system, so they will not be fertile. That's what I meant. So this example is Bruce Jenner. So he was an Olympic medal winner, and he changed, and now is Caitlyn Jenner. So he was suffering from gender dysphoria. Trauma and stress-related disorder. So an example is post-traumatic stress disorder. Here is the person has experienced something very serious, life-threatening. It can be physical or emotional. So, for example, somebody has gone through a severe hurricane or flood or tsunami, or a serious health condition, or physical attack or sexual attack, things like that. So they may have gone to war, and they may have seen things that very horrible. So this is why they have this recurring thought of that event, and they may be hyper vigilant. They may not go to sleep. They will not trust anybody. It will affect their work and their friendship with others. So it is usually a chronic problem. Elimination disorder, this is important in children. So one is for urination, the other one is for defecation. Normally children are potty trained by age 2 or 3, depends on this average. And if a child urinates after that age, that's called enuresis. Usually enuresis is a behavioral issue. It is more psychological. So if the child has gone through a serious event that affected her emotion, They may have enuresis for a short period of time. For example, parents divorce, serious sickness, or some other major events. They get enuresis and that will go away. So it's not a much serious problem. You can do a behavioral intervention and you don't need any medication for that. And copresis is much more serious because after the toilet training, and if the child is still defecating after a while, then this is a much more serious condition. It could be once in a while. It could be, for example, the child had diarrhea that could have happened, or a very stressful life situation that could have happened. But if it happens multiple times, then it's more a neurological problem than a behavioral problem. Sexual dysfunction, one is erectile dysfunction, and obviously this happens in men. That is a problem with erection, so they may have impotence. There is two different ages. One is younger than age 40. That is more common in men that had more psychological problems. For example, they were raised in a very strict environment, religious environment, or they may have interpersonal issues with their partner, so they may have erectile dysfunction. After age 40, this is more a cardiovascular problem, so people with heart disease, stroke, diabetes, they may have erectile dysfunction. This image that you see, this is actually a British advertisement, so this was convincing men that if you smoke is a risk factor for cardiovascular disease, and then increased risk of impotence. So actually it was a good campaign. And premature ejaculation has happened in men also, that they are not able to continuously perform sexual activity, and they usually ejaculate before entering to vagina, or a few minutes after, within 2 minutes of entry to vagina. So that will cause a psychological problem in men, and also psychological and interpersonal problem with the other partner. And this is actually 1/3 of men are suffering from this condition, but most never talk about this. And that is it. And if you have a question, please let me know.